Hello everyone. Welcoming your new baby into the world is one of the happiest and most memorable times of your life. We're sure you have many questions on what to expect on having your baby. I'm Bonnie Roulet, Clinical Nurse Manager of Ventura County Medical Center and Santa Paula Hospital. Today you will be hearing from a team of our doctors and nurses who will be giving you vital information about what to expect on the day of your delivery. On behalf of the entire obstetrical team, we welcome each and every one of you to Ventura County Medical Center or Santa Paula Hospital.
Congratulations, I understand you're having a baby. Welcome to the Ventura County Medical Center and Santa Paula Hospital. I'm Dr. Robert Lefkowitz. I'm the Director of Obstetrics and Gynecology here at Ventura County Medical Center. In the 31 years since I came to Ventura County Medical Center, I've never been prouder than the care we deliver now. We have a team of obstetricians and gynecologists. They're specially trained in high risk as well as normal pregnancy. We're part of a team of family physicians, obstetricians, and anesthesiologists who hope to give you the kind of experience that you and your family want. We have many options for pain control if it's something that you and your family desire. In the last year, our system delivered over 400,000 visits for medical care to citizens of Ventura County. In 1976, our neonatal intensive care unit was founded. At that time, it was the only one between Stanford and USC. Every year, our statistics are reviewed by UCLA. And every year, we're proud of the statistics that we present about the excellent care that we render to these special high-risk babies. In case you have a high-risk pregnancy, you can be assured of access to the neonatal intensive care unit at Ventura County Medical Center. Thank you for trusting us at Ventura County Medical Center. We're looking forward to seeing you.
When you believe you may be in labor and have chosen to deliver at Ventura County Medical Center, your arrival will begin in the Loma Vista Emergency Parking Lot at 3291 Loma Vista. Once you've parked your vehicle, you and your partner or birthing coach will walk the short steps up the emergency department entrance. As you enter, you will see the admitting window to your right. There you will fill out any remaining paperwork you may have yet to complete. Once the paperwork is completed, you will be given an ID bracelet for added security and sent to the OB maternity unit. After a short stop at security, where you'll show them your identity bracelet, you and your partner will be buzzed through the hallway that will take you to an elevator. Take the elevator to the 4th floor. Exit the elevator and head to the right to the OB department. Push the buzzer speaker and announce your arrival, and a nurse will buzz you in. Once you have reached the nurse's station, you will be checked in and taken to a labor room where you will be asked to change into a gown, and 2 monitors will be placed on your abdomen, one for the baby's heartbeat and another to monitor your contractions. You will be examined by a nurse or a physician to see how far along you are in the labor process. If you are indeed in labor, you will be admitted at that point to the OB unit to have your baby. If you are found to not be in labor, you will be instructed to go home and come back when your labor does progress. To make sure the delivery of your baby goes smoothly, we have a brief tour of what to expect when you arrive at Santa Paula Hospital and the general admittance process. When you believe you are in labor and have chosen to deliver your baby at Santa Paula Hospital, your arrival will begin in the Santa Paula Hospital emergency parking lot, located to the left of the main hospital entrance at 825 North 10th Street. Enter through the emergency room doors, where you will be admitted at the admitting window. There you will fill out any remaining paperwork you may have yet to complete. Once the paperwork is completed, an ID bracelet will be applied to your wrist for added security for you and your baby. You and your partner or birthing coach will then be instructed to walk down the hall to the OB maternity unit. If you are too uncomfortable to walk, you will be taken to the OB unit in a wheelchair. You will reach a security door, press the buzzer, and inform the nurse of your arrival. A nurse will greet you at the door to take you to a labor room. You will be asked to change into a gown, and 2 monitors will be placed on your abdomen, one for the baby's heartbeat and another to monitor your contractions. You will be examined by a nurse or a physician to see how far along you are in the labor process. If you are indeed in labor, you will be admitted at that point to the OB unit to have your baby. If you are found to not be in labor, you will be instructed to go home and come back when your labor does begin.
On average, we deliver between 5 and 8 babies a day. We actually had a day where we delivered 18 babies in one day. Last year, we delivered close to 3,000 babies at Ventura County Medical Center and over 400 at Santa Paula Hospital.
We're able to give very personalized care, and something that goes along with that is when a family comes in with a birth plan or they come in with specific thoughts about how they want their delivery to be, we have maybe more time to really give that to the family.
There is actually good evidence, scientific evidence, that people who come in with a birth plan have a better experience. They clearly tell us what their expectations are, and we're able to talk about it ahead of time.
When a patient first comes in, I ask them, have you thought about pain medication while you're in labor? And a lot of patients have already talked to their physicians about the certain options, which is to go natural, meaning nothing at all, or to have medications put in an IV, or to have an epidural.
Here at Ventura County Medical Center in Santa Paula Hospital, we have a wonderful team of professional nurses who are trained in fetal monitoring.
We have recently gone to a new system called OB TraceView. It's made by the Philips Corporation. We have a team of experts that are constantly using this monitor system to inform each other and to know your status as you proceed through labor.
We have 2 monitors. One monitor is for contractions and the other monitor is for the baby's heartbeat.
We check the monitor every 15 minutes, make sure the baby's heartbeat is within normal limits, and make sure mom's coping well with her contractions. We are at mom's bedside at least every 30 minutes, if not every 15 minutes.
We're very pro-normal delivery here. We really have a very, I would say, low normal cesarean section rate at this hospital, which I'm proud of. We really do try to include the whole family in the birthing process. If the dad wants to cut the cord, he gets to do that, and try to get the baby right up onto the mom's tummy so that they can really bond and feel the incredible rush of love that you feel for that baby when you first hold it.
What makes us special from other hospitals here at VCMC and Santa Paula Hospital is that we are baby friendly. Our very first priority is to have the baby and the mom bond together. Right after delivery, within the first hour, we make sure that mom and baby get skin to skin. They're together and they bond and they have that emotional connection.
Once the mother has delivered, the baby is usually placed right on top of mom's tummy or chest, and helps with the bonding process.
Skin-to-skin contact immediately after delivery is very important. As long as everything is okay, the baby is put directly onto mom's belly and covered with warm blankets, and the baby is left there until after the baby has breastfed for the first time. When a baby is put directly skin to skin with mom, it does many things. One of the things is that it stabilizes the baby's blood sugar. Mom's body keeps the baby much warmer than our radiant warmers can, and helps the baby initiate his or her own breastfeeding pattern.
We try to get the baby onto the breast as soon as possible. The babies tend to be really alert when they first come out, and that's an ideal time for them to latch on and initiate the lactation process. The earlier they latch on, the sooner mom starts lactating.
We have a lactation consultant here on our floor who goes around and makes the breastfeeding experience a positive one for the mothers, and also helps them if they're having difficulty with their breastfeeding.
Breastfeeding has been studied and encouraged for many years, but more studies have shown that breastfeeding is so much better for babies.
The baby will not be as sick as the baby grows older. The baby will have less asthma, ear infections, upper respiratory infections, less visits to the doctor's office. The benefits of breastfeeding for mom include lower risk of reproductive organ cancer, breast, cervical, uterine. She'll bleed less after delivery. She'll lose her pregnancy weight a lot faster.
I think there's nothing quite like the experience of feeling that attachment between you and your baby when you're breastfeeding. I just have never met a mom who's breastfed for a significant period of time who hasn't really loved it.
After the hour of bonding, baby goes to the transitional nursery. What they do there is pretty much weigh the baby, give the baby its first shots, medications in the eye, do the length, bathe the baby. And after that hour that the baby is in the transitional nursery, then baby goes directly back to mom. And baby and mom board together until they go home.
We are a baby-friendly institution. We want mother and baby to remain together as much as possible. We have 24/7 rooming in. Your baby will remain in the isolette right next to your bed. We want the interaction of mom and baby to be a very natural process. And so we encourage you to hold your baby and to bond and skin to skin as much as possible with your baby here. We realize that you want to share this very happy time with your entire family. We do need to look at the balance between visitation and mom's rest. So we limit the number of visitors to 2 visitors at any given time.
When your infant is ready to go home, there are a couple items you're going to need to have. One is a functional infant car seat. Please have it snugged securely into the car prior to the baby coming out to the car to be placed into that car seat. Secondly is an infant outfit for your baby to wear home. Make sure it's cute, but please make sure it's comfortable for your baby also. Once you get home, if you have any questions or any concerns, please feel free to call us anytime, day or night. We're open 24 hours a day.
Thank you for participating in our tour today. I'd like to thank you for choosing Ventura County Medical Center or Santa Paula Hospital for this very special occasion.